I'd like to turn over the microphone now and introduce Jay Angoff. He's the Senior Advisor to the U.S. Department of Health and Human Service Secretary Kathleen Sebelius, and he is responsible for a number of private insurance reform elements that are encompassed within the Patient Protection and Affordable Care Act. And Jay has been nice enough to join us here today, and we're eager to hear from him as well as to ask questions afterwards. So with that, please join me in welcoming Mr. Jay Angoff.
Thanks, Seth. Thanks for the great work you've been doing, and thanks to the Global Healthy Living Foundation for the great work that you all have been doing. Today is the second anniversary of the enactment of the Affordable Care Act. It was enacted on March 23, 2010. It won't be fully in effect until January 1st, 2014. On that date, for the first time ever, anyone, any citizen of the United States, regardless of health condition, will have the absolute right to buy insurance from any insurance company doing business in that person's area, and will also have the absolute right not to be surcharged based on pre-existing condition. That's a fundamental reform. It's a revolutionary reform. It obviously is going to do a tremendous amount of good for a tremendous number of people. That'll be in effect on January 1st, 2014. But until then, there are already in effect several provisions that are particularly beneficial to people with pre-existing conditions. And let me mention just three. The first is the new pre-existing condition insurance plan, which under the Affordable Care Act went into effect 90 days after the enactment of the law, and today is in effect in all states. And what that provision allows is for anyone, again, anyone regardless of pre-existing condition, in fact, it's for people with pre-existing conditions, can go to this program, can apply on a website, which is www.pcip.gov. If you qualify for this plan, you can apply on that website, and if you are accepted for coverage by the 15th of the month, your coverage takes effect on the 1st of the next month. And to qualify for this program, you need to meet three criteria. You need first to have a pre-existing condition. Second, as I said, you must be a citizen or a legal resident of the United States. And third, you must have been uninsured for 6 months. Under current law in most states, insurance companies have the right to decline people based on health status, and they've got the right to surcharge people based on health status. For that reason, many people with pre-existing conditions cannot get insurance in the private market. If a private insurance company has declined you and you haven't had insurance for 6 months, you can go to this website, pcip.gov, and apply for insurance through the PCIP plan. The advantages of this plan are many. The first is, and the most important advantage is, through this plan, even if you have a pre-existing condition, a serious condition for which, based on which a private insurance company has declined you, you can get insurance, and not only can you get insurance, but you can get insurance at the same rate that you would pay if you were in standard health. That's obviously a tremendous program. It's already helped and saved the lives of tens of thousands of people. There are more than 50,000 people who are already in this plan. And so if anyone there knows, either has a pre-existing condition themselves and has been uninsured for 6 months, or knows someone who's got a pre-existing condition and has been uninsured for 6 months, I strongly encourage you to take advantage of this program, which is in effect right today, and to go to pcip.gov, follow the instructions on that site, and you can get insurance, and that insurance will cover your pre-existing condition. So that's one provision that's in effect right today and that is already helping people. A second provision, which is very important for young people, whether they've got a pre-existing condition or not. I happen to have a daughter who's 22 who will personally benefit from this, and that is the provision that allows kids up to the age of 26, young adults up to the age of 26, to stay on their parents' policies. This has already benefited more than 2.5 million people in this country, including people, young people with pre-existing conditions. So that's another very important provision which is already in effect today. The third provision, which is really beneficial for people with pre-existing conditions, is the provision that makes it unlawful for insurance companies to cut off coverage once you reach a certain lifetime limit. Until the Affordable Care Act was passed, insurance companies would often sell policies that cut off at $1 million or at some other level, so that if you got really sick, if you happen to have the bad luck of getting really sick, your insurance cut you off after a certain point. Well, that's unlawful today. There are no lifetime limits allowed, so that is another provision which benefits people, and specifically benefits people with pre-existing conditions. So all those provisions are in the law today. As I said, on January 1st, 2014, the law expands. The pre-existing condition insurance plan will no longer be necessary, because then private insurance companies will have the duty, the legal responsibility to insure anyone regardless of pre-existing condition, and they'll be prohibited from charging people more based on pre-existing condition. So that's the law that'll be here in 2014, but until then, there are these other provisions that are already in the law. People should really take advantage of them. And one of the most effective means of getting the word out about these provisions is for people to submit real-life stories. Nothing has a greater effect than people who have really benefited from these provisions. Kids, young adults who are 22, like my daughter, or 23 or 21, who can now stay on their parents' policies who couldn't before, or kids or people, whether people of any age, who have pre-existing conditions and have been turned down by private insurance companies, but who have been accepted into the pre-existing condition insurance plan. People like that, if they would tell their real stories, that will have a great effect on getting the word out as to what a tremendous advantage, tremendous advance the Affordable Care Act is, how it's already benefited so many people, and how it will continue to benefit people for years and years into the future. So Seth, thanks again for having me here today, and thank you again for the great work that you and the Global Healthy Living Foundation have been doing.